Good afternoon, and thank you for joining the webinar. My name is Cynthia Thaler, and I'm a policy analyst at the Council of State Governments Justice Center. Before turning to the content of the webinar, I'd like to briefly talk through a couple of housekeeping items about how the webinar is going to work, and then take a brief moment to tell you about the National Reentry Resource Center. Anytime during this webinar, you may ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. We'll keep a running list of the content-related questions we receive, and then ask the panelists to respond to the questions during the last segment of the webinar. We'll do our best to get through as many questions as possible today. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. And please understand that there are some technical issues you may not be able to resolve, and for this reason, we're recording this event and we'll post it on our website. And we should have the webinar recording as well as a PDF of the slides posted online within about 2 weeks. On today's webinar, we'll be discussing strategies for effectively implementing evidence-based programs and services for youth in the juvenile justice system. And we have an exciting group of panelists with us today who I will introduce shortly. But I'll first begin by providing a quick overview of the webinar. First, I'll briefly introduce our speakers and tell you a bit about the National Reentry Resource Center. I'll then discuss the CSG Justice Center's newly released online implementation tool available on this topic area, and we'll provide background on evidence-based programs and services and some of the barriers to effective implementation that jurisdictions have faced, as well as strategies to overcome those challenges. I'll then turn it over to our two guest speakers who will provide their expertise and insight based on their experience in Milwaukee County and Pennsylvania. And finally, we'll have at least 20 minutes at the end of this webinar to address any questions you may have for today's presenters. And we encourage you to type questions into the box on the bottom right-hand corner of your screen at any time throughout the webinar. I'll begin the discussion today before turning to our two guest speakers. And I'm a policy analyst at the Council of State Governments Justice Center, and I provide technical assistance to juvenile justice agencies as well as nonprofits across the country that receive Second Chance Act grants. Deshell Parker is an administrative coordinator for the Delinquency and Court Services Division in Milwaukee County, managing the Quality Assurance Department for the division. And since January of 2014, she's held a variety of positions in the community and social services fields, including child welfare social work, foster parent training, human resources management, program coordination, and social work consultation. She holds a Master of Science degree in Organizational Management and Leadership that she received in 2003, and a Master's of Social Work degree received in 2009, and is also a Certified Advanced Practice Social Worker in the state of Wisconsin. Dr. Stephanie Bradley is the Director of the Evidence-Based Prevention and Intervention Support Center, otherwise known as the EpiCenter. And the EpiCenter is a statewide intermediary organization in Pennsylvania focused on translating research to policy and practice to prevent youth delinquency and other detrimental youth behaviors. Dr. Bradley currently works with state and local policymakers to build their knowledge of what works and their capacity for ensuring the high-quality implementation and sustainment of evidence-based programs and strategies. Thank you to both of our presenters for participating on today's webinar. The Council of State Governments Justice Center is a national nonprofit that serves policymakers at the local, state, and federal levels from all branches of government. We provide practical, nonpartisan advice and consensus-driven strategies informed by available evidence to increase public safety and strengthen communities. The Second Chance Act, which was signed into law in 2008, is the first federal legislation passed by Congress to authorize federal support for reentry programs, and the bill authorized up to $165 million in federal grants to state, local, and tribal government agencies and nonprofit organizations. In 2009, following a competitive process, the CSG Justice Center was selected to launch the National Reentry Resource Center and provide training and technical assistance to all Second Chance Act grantees. And the National Reentry Resource Center is administered by the Council of State Governments Justice Center in partnership with the Bureau of Justice Assistance. The Justice Center is constantly adding new content and resources to our website, and we send out a monthly newsletter that provides information about the latest research, funding opportunities, and distance learning events, and other news about reentry. And to sign up for our newsletter, please visit csgjusticecenter.org/subscribe. So why is it so critical to effectively implement evidence-based programs and services? Both research and field experience show that implementing evidence-based programs and services with fidelity correlates to reduced recidivism and improved outcomes for youth. Juvenile justice agencies and contracted service providers often encounter challenges in identifying the appropriate services for their community. And once the program or service is identified, practitioners often struggle to implement them properly and consistently and in ways that lead to better outcomes for youth. So in January of this year, the CSG Justice Center developed a resource to address this challenge in an effort to provide strategies and tools and best practice models from across the country that state and local policymakers, as well as juvenile justice agency administrators and staff, and other practitioners can consider adopting to promote and effectively implement evidence-based programs and services with fidelity. The resource is organized by 4 key challenges we often see in the jurisdictions that we work with through our experience providing technical assistance. I'll briefly walk through these challenges and discuss the strategies that agencies might consider in their own efforts. On our website, we also have links to examples and tools and sample models from across the country of jurisdictions that have done this work on the ground, and you can draw from those as you plan your jurisdiction's implementation strategy in your own jurisdiction. So one key challenge is identifying funding and promoting evidence-based programs and services. Jurisdictions often struggle to identify the best program for their specific population and obtain sustainable funding for those programs. There are a number of databases and clearinghouses that are available online that provide information about programs and services to youth, as well as summaries of the research base for a particular program and target populations. And many of these databases are searchable by program area, including topic area of interest, as well as point in the juvenile justice system. Policymakers have also required in some jurisdictions that programs and services used for youth in the juvenile justice system are evidence-based. So some states have passed laws requiring such, and others have used weighted funding formulas to provide additional funding to local jurisdictions that place youth in evidence-based programs. Jurisdictions have also had success providing funding to evidence-based programs and services in innovative ways, including pooling funding from various child-serving agencies and passing state law to fund training and technical assistance support to juvenile justice programs. At least one state has even amended its Medicaid program to cover community programs that youth in the juvenile justice system can utilize. And there's also a range of federal funding opportunities that service providers and government agencies can apply for through the Office of Juvenile Justice and Delinquency Prevention. Other states, such as Pennsylvania, released requests for proposals that require the use of programs that are evidence-based, and which you'll hear panelist Dr. Stephanie Bradley speak to later in this webinar. Another challenge we often see in jurisdictions we work with is matching youth to services based on their assessed risk and criminogenic needs. So while several states recognize the benefits of using a risk and need assessment instrument and have implemented a tool in their jurisdiction, very few are truly using that tool effectively to make decisions to appropriately refer youth to services. And this is critical because if youth are not connected with the services that address their needs or match their risk level, there's really a missed opportunity to effectively impact the likelihood of recidivism. And in fact, research shows that over-servicing youth may actually increase the risk of recidivism for low-risk youth. So jurisdictions can really be most efficient and get the most out of limited resources by matching youth, the right youth, to the right services. One tool we've seen jurisdictions use to address this is developing a registry of service providers and available programs that staff can access when they're making service decisions. Other states have gone a step further to provide staff with written policies and procedures and service matching tools. A case planning manual can provide staff with detailed criteria for conducting risk and need assessments and using that information to match youth to services. And something as simple as a written manual can really go a long way toward enhancing service matching, as well as maintaining consistency across staff and sustaining service matching protocol over time as staff inevitably turn over. A service matrix is also a helpful tool to provide staff with guidance on appropriate services for youth based on risk level and criminogenic need. Some jurisdictions have even automated this process so that staff can receive immediate guidance on available programs and services upon entering a youth assessment information into their data system. Many state and local agencies say that they're using evidence-based programs and services, but often when we dig deeper in our discussions with them and ask follow-up questions, we learn that they don't have sufficient quality assurance protocols in place to ensure service quality, or they've quote-unquote adapted a program to meet their jurisdiction's needs, or sufficient training is not available in an ongoing way to staff and service providers. It's really important that agencies establish service quality standards and assess adherence to program models that are being used to have the greatest effect. We'll hear from Ms. Parker in Milwaukee County about the continuous quality improvement cycle they've implemented to assess programs and services. And Dr. Bradley and her team at the Pennsylvania Epicenter implemented a program fidelity rating tool and checklist to assess the extent to which programs adhere to the developer's model. And both Pennsylvania and Milwaukee use the standardized program evaluation tool, which is one tool that can be used to assess how closely programs adhere to the standards of effective programming. Training and oversight of agency staff and service providers is also critical to ensure that evidence-based programs and services are implemented with fidelity. And some states have established resource centers to provide training and technical assistance to promote adherence to evidence-based programs and services. And you'll hear more from both of our presenters shortly about their work in that area and what has worked best for them. The final key challenge that I'll discuss today, it speaks to the importance of collecting, utilizing, and reporting data on service provider outcomes to guide service and funding decisions. This is probably the biggest challenge that we see in the jurisdictions that we've worked with. And we find that some programs and agencies collect data, but they rarely analyze it to make or use it to make decisions about funding or funding priorities or future service needs. Other programs collect data but don't report that back to the Juvenile Justice Agency, and some jurisdictions simply lack the data infrastructure to effectively collect and analyze service data. So one strategy that jurisdictions often find valuable is setting target outcomes and performance standards for programs that are provided to youth. There are existing protocols that jurisdictions use, such as performance-based standards, which encourages agencies to use national standards and outcome measures for youth who are incarcerated. Other states have developed their own standards to guide their programs at different points in the juvenile justice system, such as detention, residential placement, and in the community. We've also seen jurisdictions establish policies and systems and tools for service providers to collect and report data on youth progress and outcomes in services. Some jurisdictions require that providers collect and report on program data, and they actually analyze this information and report it back to the providers. You can find sample spreadsheets on our website in the implementation tool, as well as examples of comprehensive data systems that track referrals and services received, as well as outcomes for youth who enter the system. Legislation can also be a useful tool to require the collection of service outcome data and provides an additional layer of accountability by requiring reports or regular reports to the legislature. And finally, juvenile justice agencies can institute formal service review and accountability and improvement policies. And both of our speakers from Milwaukee County and Pennsylvania Epicenter will speak to their efforts in this area. And you can also find sample performance improvement plans on our website, as well as statutes that require provider accountability. To access these tools, please visit us online at csgjusticecenter.org/youth/evidence-based programs and services. You can utilize this tool to assess your own jurisdiction's practices in implementing evidence-based programs and services and access tools and examples from jurisdictions across the country. You'll also find on our website a tool focused on implementing family engagement and involvement practices, and participants on this webinar will receive a survey at the end of the webinar to provide feedback on other topic areas that would be most helpful to support your jurisdiction in your implementation efforts. On the CSG Justice Center's youth page, you can also view other resources available on key areas that are critical to improving outcomes for youth in the juvenile justice system. The Office of Juvenile Justice and Delinquency Prevention provides a number of resources on this topic, and this includes OJJDP's Model Programs Guide, which provides resources to support policymakers and practitioners at the beginning stages of implementing intervention and prevention programs for youth in the juvenile justice system. Additional resources are listed on this slide, and this slide, as well as the full deck, will be available on our website following the webinar. And now we'll hear from two distinguished speakers who have experience and expertise supporting the implementation of evidence-based programs and services. And with that, I will now turn it over to Deshell Parker, who will discuss the her ongoing work and support to support effective implementation of programs and services in Milwaukee County. Thank you.
Good afternoon, everyone. Thank you so much, Cynthia. I am Deshell Parker, as stated, and I appreciate everyone's time this afternoon. I'm actually going to be talking with you about what has been happening here in Milwaukee County. We are formally titled the Delinquency and Court Services Division, which is essentially the youth justice system for Milwaukee County. So this is basically a pictorial of what our system looks like. It's basically a way to make sure you understand, as I talk through some of the components and elements I'm talking about today, what exactly it is we do and kind of who we are. So this represents the entity that I work for. We're governed by the Department of Children and Families, State of Wisconsin, as well as the Department of Health and Human Services from Milwaukee County. And then we're responsible for all of these elements. So a lot of what I'm going to be talking about here today is our service network and the continuous quality improvement plan that we have as a part of our service network. But it's just important to understand that as I talk about that, in order for anything here to be effective when it comes to actually servicing the youth that we make the referrals for, all of these elements also kind of have to be touched and collaborate with that process in order to be successful. So this is kind of who we are and what we do. Now let's get into the actual CQI cycle itself, which is our continuous quality improvement cycle. A little bit about how it kind of started and where we came from. In 2013, we were awarded a grant, the Juvenile Justice Reform and Reinvestment Initiative grant. That was a partnership between OJJDP, Georgetown Public Policy Institute, as well as Urban Institute and Vanderbilt University Peabody Research Institute, who was actually responsible for developing that SPEP tool that Cynthia mentioned a little bit ago. With that grant, we actually implemented that SPEP tool here in Milwaukee in 2014. It's basically the evidence-based tool that I'm going to be talking to you about today and some of the challenges or barriers that we've experienced in implementing that tool. As a way to manage all the various moving parts and pieces of that evidence-based tool, like with many evidence-based tools, we needed a process to really manage all of those moving parts, and that is where this continuous quality improvement process came from that was established in 2015. And we do have a mission for that process, and to really break that mission down, to explain it in a way that makes the most sense, is basically to support the youth justice process. It's about improving outcomes for youth, and it's about doing it in a systematic and comprehensive way that incorporates all of the tenets of quality. So now let's look at that cycle specifically so that you can understand how it actually works. Now this is a graph of our continuous quality improvement cycle, and it basically goes over a period of a year. We start here in the fall around September, and that's when we start to do some of our education and training during this time frame here between September and December. And essentially between September and October, we disseminate scores from that actual SPEP tool that we referred to. We send out that introduction email first to kind of remind everybody that it's that time again. We disseminate those SPEP scores, and then in October we hold a formal information session, and that's basically when we bring all of our provider network together and we all get in one room and we really talk about, from a quality perspective, what has been going on over the course of the last year. After that, in November, we hold a training, and this training is for all of our providers and is really based on whatever gaps or trends or issues that we've seen over the course of the year that need some kind of support or help in addressing whatever that issue is. The whole concept behind that training was really to say, if we're going to introduce this CQI cycle and kind of expect you to participate in all of these elements of the cycle, we also need to be able to give you some resources and tools to be able to do that, put some things in your tool belt to be able to help you sustain through this process as well. So once that training is over, at the end of December, or basically the end of the year, our providers then submit action plans to us that basically incorporate everything that has happened in this education and training time frame. So based on the information that we've shared, your scores that you received, the training, you've had enough opportunity in this time frame to kind of meet with your internal folks and really come up with what is our program improvement project going to be over the course of this next year. And then you capture that in the action plan, which I'll show you a little bit later in this, and you submit that to us. Then following that, in the first of the year, January, February, sometime between January and April, we do provider site visits where we go out to each of our providers and we basically have more of a detailed conversation around quality. We look at your action plan, we assess the progress from last year's action plan, we make sure your goal makes sense, it's aligned with whatever goals we've set up from our information session prior that year, and address any other things we need to during that time. And then for the rest of the year, we're actually holding these provider forum meetings throughout this entire time, where every other month we get together and we share whatever information we need to share with them, whether it's contract changes, updates, policies, things of that nature. But basically this is a graph that illustrates that actual CQI cycle. And as you go through the rest of the year, you basically start all over again when we get to September, and we go through that entire process again, and that's every year. So that's the way the cycle kind of rotates and floats throughout the whole year. And this cycle really gives us an ability, a really comprehensive, systematic way to consider all of the various elements that are needed for that SPEP tool that we use. Now, with this, in order to really apply quality, there's more than just quality improvement that we have to consider. Quality improvement is really a part of a greater process, and we have three tenets of quality that we look at when it comes to how we apply quality in this system in general. And when it comes to that, we have these three elements over here. We have quality assurance first, which is basically the concept of contracting and setting performance measures, some of those basic things. You kind of have to set the stage with these things before you can build on any of the other things. Then we also have the quality control element, and that really speaks to some of the auditing that regularly goes on, as well as this SPEP tool that I've talked about, the Standardized Program Evaluation Protocol. Applying that is somewhat of a form of auditing. And then we also use what we call the NIATX model, which is capital N-I-A-T, lowercase x, and it is an evidence-based model of process improvement that is specifically for behavioral health care settings. And that's actually something that can be Googled. They have their own web page and information. But basically, NIATX, SPEP, and auditing, those are various things that we do in the quality control area. And then we have the quality improvement area, which speaks to those components of the CQI cycle that I've already gone through, the program improvement projects that come from that, as well as our application of the PDSA, which is Plan, Do, Study, Act. You guys probably have heard that before, but that and the action planning are the elements of quality improvement that we use. So it's through the application of all three tenets of quality that we're really looking at quality and managing quality. But with that being said, when it comes to applying quality, we also have the barriers to that application that we need to consider. And these barriers come in a number of different forms, like with most things. We have barriers of the tool itself. With any evidence-based tool, there's always going to be that gap between what worked in the controlled setting when it was created and then what actually happens when you get in what I like to call the real world. So there are definitely limitations to the SPEP tool when it comes to applying it to figure out the effectiveness of services. And that comes from it maybe wasn't included in the research. The SPEP is based on research that is done in a set amount of time, and if whatever service we're looking at was not actually included in that group of research, then we can't apply the SPEP tool to that. Now that doesn't mean that every service that we offer was included in the research, and it doesn't mean that we should limit our service pool to only those that were included in the research. By default, that means we're going to have some things or services out there that we cannot apply that tool to. And so that's just an example of the limitation of the tool itself. In addition to that, in order to use the tool, you have to have a youth assessment or risk scores, which has been mentioned already today. We only implemented an effective assessment instrument in about 2012, 2013 of this year. So when it comes to looking at data, for our youth and the assessment scores that they produce, we got to consider the fact that for the first couple of years, the tool wasn't even being used appropriately. So is that data even accurate or reliable? Not to mention the fact that before we started using that tool, we didn't have an assessment tool in place, so there are no risk scores to consider. So there are limitations there that are just a fact of life in the real world. In addition to that, we have cohort sizes. In order to use the tool, you have to actually meet a criteria for the sample size. Cohort sizes, another way to look at that is referral numbers. Referrals have to actually be made to the services, and then the service providers have to actually engage the youth in order to actually meet that cohort quota. And if that's not happening or it's not happening effectively, then you're not going to meet those cohort sizes requirements that are needed to implement that tool. One of the things that can't go without being mentioned is the stakeholder buy-in. When I showed you the graph of the system, you can clearly see that there are a number of different elements that go into creating the system. So it's a lot of different people you got to consider, and getting all those people on board by virtue of just the mass quantity that we're talking about, that in itself is difficult. But I will say one of the biggest issues or biggest barriers is that data infrastructure, the limitations to that. And we were definitely working with a system that had over 100 different disparate databases, none of which talk to each other. So when it came time to try to pull data together to actually tell a story, we were definitely at a disadvantage, to say the least. So as we move forward in looking at some of these pieces, we're going to look at some of the strategies that we've implemented to try to address those barriers that I've just outlined for you. So from a system perspective, I think having a communication plan is the biggest deal to kind of start with. Before our implementing this CQI cycle, there had never, ever been any kind of quality improvement efforts in the juvenile justice system here in Milwaukee at all. So it was brand new for everybody. So that's why it was important for us to champion the cycle first. We didn't lead with scores or numbers because we know numbers can produce mass chaos among folks. So we led with the cycle first and getting folks used to what it meant to be on that cycle and to produce improvement projects without actually giving you those numbers from the SPEC process, because we didn't want you to lead with the competitive nature, but to get comfortable with the new environment. We also had to modify some things internally from our contract language to boost up the language around QA, QI expectations, as well as our service referral process. I think one of the biggest things that we were able to do when we were involved in the grant was to leverage our partners in the grant. Every time they visited us in Milwaukee, we made sure our Director of Health and Human Services was present. We made sure we got the county exec on board. We leveraged those partners in our need for the data system, and we're able to explain what we're not able to do clearly, and use those partners to be able to say they're not going to be successful at all as a youth justice system without being able to do these things. So that was huge with us being able to get a new data system and implement some data programming and entry processes for providers and some of the things that we were able to change around our data system in general. In addition to that, we had some staffing changes where we developed and expanded an actual quality assurance department. Prior to our involvement in this, we did not have QA staff. It was just something that was expected, people were expected to do as a part of their regular jobs. We have a provider-focused team, which includes our clinical directors, program coordinators, quality assurance, some key clerical staff, as well as IT people that come together and meet on a regular basis bi-weekly just to talk about what we need to do around our provider network. We also reimburse our providers for mandatory meetings. So these additional things that we started to require them to do, we found a way to reimburse those sole clinical providers who wouldn't be paid otherwise by attending those meetings. And then we also developed specific support tools, policies, cheat sheets, tutorial guides, different things of that nature that would help our providers understand what it is we were doing, why we were doing what we were doing, the direction we were going in, and giving them kind of cheat sheets along the way with regard to what it was that we was expecting them to do. Now that we've talked about that, I think it's most important to talk about how we actually engaged our providers beyond what we as the system did. One of the biggest things, and that's why it's listed first, is that we did engagement before implementation. So before we actually made this CQI cycle a requirement for our providers, we engaged them in the conversation first. We talked to them about what it was that they needed, what they wanted to see happen in the community with the youth, what kind of standards they wanted to be set by us as a youth justice system, and we incorporated those things into CQI so that they felt like it was something that was being done with them rather than to them. And that's something that historically governmental agencies do not do. In addition to that, we shared a lot of data with them, whether it was agency-specific or general network data. If it was about time frames that your notes were supposed to be in, discharge entries, time frames between the time we make a referral and then you actually engage and see the youth, what are the trends around that? We shared it from a general system perspective as well as the agency-specific perspective, because those were things that were very important. We were very transparent in showing them that information. We also provided a lot of training during this time, whether that was one-on-one with individuals from a specific agency or in a group setting at those bi-monthly forum meetings that I mentioned, where we talked about the assessment that we were now using, case planning, documentation expectations, data entry for the various types of programs that we have, youth engagement training. We've talked about done goal setting training. We've done a number of trainings on the CQI process and the expectations The NIATEX model that I mentioned to you, we trained all our providers in that model and gave them examples on how to use it, so it was a lot of training and coaching involved in this process. I've already spoke about the bi-monthly forum meetings, and we really used this as an opportunity for open discussion throughout this time. If it was issues that came up, we were sure to follow up on those issues. I talked about the fact that we provided training during those times. If there were policy changes that were going on, then we talked about those policy changes. And agencies even presented their program improvement projects. Now, our biggest strategy has to do with our Provider Ambassador Program, which is basically a select group of providers that we identified to actually help us develop the CQI process. So they actually spoke with us in advance. We used that as an opportunity to educate them heavily on what that SPEP tool was, the elements of it, and the whole plan that was created in collaboration with them. They co-facilitate the provider forum meetings with us. They co-facilitate the information sessions that we talked about, identify trainings. They participate in that. So they're definitely key partners in this entire CQI process, and it's not something, again, that we're doing to them, but they feel very much a part of the process, and then they, in turn, can champion that message to other providers, which is the message of collaboration versus competition among one another, and we really try to break down those barriers between the purchaser and the purchasee relationship, and this has been a great way to do that. We have one specific provider who's talked about the fact that they've been in our network for over 20 years and never once have they been engaged in a process before it actually happened. It's always been something that was done to them and they were expected to do after the fact. So this is something that is really groundbreaking with regard to the approach that we took with this Provider Ambassador Program. And with that, we've given them awards. We commit to seeking input from them. They mentor other providers and look for other providers to become a part of the Provider Ambassador Program. So it's definitely a huge piece, and we acknowledge them tremendously for their role in that. Now, this is just another look at the same cycle that I showed you before, but this is one of the tools that we use to engage and educate and explain. The only difference here are the circles, and these particular circles are around the things that the provider ambassadors are actually responsible for doing as a part of our CQI cycle. And this is available on our website. We have it in brochure form. We go over it at our info session, and we have hard copies available every time we meet with our providers at any point. This is another tool. I talked about the action plans that they submit. This is an example of what that looks like. So we identify the concern or the area of a focus here, and then the providers come up with a goal. They summarize the project, talk about who's going to be responsible for it, and then we set timelines around that and hold them to that. So this is just a sample of a tool that we've used to engage our providers. So at this point, we've talked about who we are as a system, how we view quality, the background of our CQI process, and the strategies that we've used for engagement. So it's time to do a little bit of reflection at this point. So what lessons have we learned? What worked well for us was that Provider Ambassador Program that I mentioned. It helped us develop allies in the process, and it helped us gain real insights. When we set deadlines for when things should be due or how we should go about doing things, we ask the folks who do the work, what's realistic? What makes sense for you? We anticipated that there was going to be resistance. That's why we engaged the community first. That was huge. We had an actual communication plan that we put together. We didn't just, again, do this to them, but we set our primary audience, our secondary audience. We focused on the cycle first, allowed that time to adjust, and we introduced the elements of this evidence-based tool rather than just giving them a score and expecting them to understand that. So we started building that process slowly. And then we also had passionate folks involved with the support of administration in order to be able to push this forward. If you're beating your head up against a brick wall internally, you're never going to be able to carry that message externally the way you should. With that being said, what did not work? One of the things in looking back is that we did not pilot this tool. That was probably one of the biggest mistakes we made. Instead of just using it on a select few, we did it with our entire network, and you can imagine that that was quite an undertaking. It is still quite an undertaking. We would have learned a lot by piloting it first and been able to work out the kinks, but hindsight is always 20/20. In addition to that, the data infrastructure barriers. Not having that data system initially, we were literally doing all of this manually, counting each use, each service by hand, and trying to use this evidence-based tool, and that was an absolute nightmare. In addition to that, we've had sole reliance on this evidence-based tool, and we talked about that gap between what happens in that control setting and then what actually happens in the real world, and us relying solely on this evidence-based tool was definitely not the best strategy to use, even if you consider it in terms of a clinician who is using cognitive behavioral therapy modality. They have to have more tricks in their bag than just CBT techniques, because that's not going to apply to every client every time. So you've got to have more tricks in your bag. So the fact that this is the only trick we had in our bag is definitely one of the limitations and the lessons we've learned. In addition to that, when you have staff who have other responsibilities in addition to the CQI, that's a big mistake. CQI in and of itself is a full-time job for several people. So having them being responsible for multiple things is a sure way not to be able to use your CQI cycle to fidelity. So lastly, I just want to reflect back on, I talked about those barriers at the onset of this. And with those barriers, I don't really want you to pay attention to a lot of these percentages and what you see here. What I do want you to gather from this is that without that data infrastructure, our being able to tell this story would not be able to happen, because we need to be able to collect that data and show what we know, what we don't know, and how far we've come. Now, while you're looking at this, of 137 total services that we looked at to use that evidence-based SPEC tool that we have, what we know was that 106 of them were not appropriate for the tool. And while that looks like a large percentage, because that's 77%, that's definitely a majority of our services that we couldn't use that tool for. Without having the data and collecting that information, we would not have known that that was actually a reduction from 95% when we started this. So you're not able to see the success that you actually did have if you're not collecting that data to be able to tell the story. So we wouldn't know our barriers, we wouldn't be able to tell exactly where we've come from, and it wouldn't be able to tell us what our next steps need to be. So without having that cycle in place, even though we've got the barriers and the issues and the limitations, we don't have a way to be able to effectively learn and grow from everything that we're doing. So this final slide basically talks about what we're going to do now. And rather than going through this list of all these things, the point of this slide is to say that we need to build, continue to build on our quality assurance and CQI overall understanding with everybody, whether that's the providers, our external stakeholders, internal stakeholders, whatever it is, the training, the education. These pieces that we're looking at is really about building that understanding and continuing to build the buy-in or get the buy-in from all these various people involved. In addition to that, we are going to be focused on our biggest issue or our biggest gap. What is the biggest reason that we weren't able to apply that tool? Let's look at that and then peel back the layers of the onion so that we can figure those pieces out. And then increasing the training and support for our staff and for everybody involved, including the providers. Those are the three main things that all of these tasks that are listed here will do for us, but the point is we wouldn't be able to identify this or know any of these pieces without being able to collect the data. So in closing, the main point to understand is that there's always going to be a gap between what I call the academic world and the real world. That is absolutely a fact, because what makes sense in a classroom setting is not going to make sense when you get to the real world and it's time to actually do it. So rather than arguing about that, you need to focus on the fact that it does exist and figure out a way to manage the pieces in that gap. Always think of your partners as customers. If it was you, how would you want to be treated? What would you want to be done? How would you want that to be done? And message it as a joint journey. It's not something we're doing to you, it's something we're doing with you, and we're going on this journey together. Be transparent about what your strengths and your weaknesses are so that they actually feel like they are a part of the process and it's not something that is being done to them. And that's all I have. So I believe Stephanie is going to go next and talk about the Pennsylvania Epicenter.
Yeah, thank you. I always appreciate getting the opportunity to hear you present, Deshell, because I really appreciate how much of a strong champion you are for the STEP and for partnerships. So thanks for all of that. I think you actually set up my section pretty nicely to move forward. So hi, everyone. Stephanie Bradley. I'm the director of the Evidence-Based Prevention and Intervention Support Center. As was touched on in the introduction, we're an intermediary organization that provides technical assistance and trainings for policymakers and practitioners with the goal of helping them to understand what works in prevention and early intervention for youth problem behaviors, including juvenile delinquency. And really with an intention to help understand then how to successfully implement what works, both at a policy level and at community levels. So there's a lot of interest in our work nationally and internationally from foundations as well, because we focus on monitoring program implementation and outcomes, and that's fairly unique in the space of intermediary organizations. So we are funded by the Pennsylvania Commission on Crime and Delinquency and the Pennsylvania Department of Human Services Office of Children, Youth, and Families. We are a grant-funded project that's housed within the College of Health and Human Development at Penn State University within the Prevention Research Center. So Epicenter was formally established in 2008 after many years of partnership between PCCD and the Prevention Research Center. And really, our becoming a center was built on a history of the Pennsylvania Commission on Crime and Delinquency funding evidence-based initiatives and the PRC conducting high-quality evaluations of those evidence-based initiatives. So there was a really, it's been a long history of sort of dynamic interplay between the state agency and the state university around funding what works and evaluating what's going well with that implementation and what needs support. And over the course of that partnership, they formalized Epicenter as an entity to provide technical assistance to communities. And in terms of this partnership, it's really been facilitated by a few key characteristics that I think are fairly important for anyone thinking about trying to develop a partnership with a university. And those would include things like, truly PCCD and Penn State really had some common and shared goals around improving the lives of youth and families, obviously coming at that from different directions in terms of policy and research, but really having genuine shared interest there. On both sides, both organizations had really strong leaders and champions for understanding what works and wanting to provide that kind of support in the state, and also characterized by high levels of trust across both organizations. So that's just a bit of our background in terms of how we came to be. So I'll give a little bit of more clarity around our work and describe how we're organized and what our goals are here. So this is a depiction of how we're organized in the state. As you can see, we are overseen by a multi-agency steering committee that has representation across multiple system areas, including juvenile justice, child welfare, education, health, among others. And that committee includes both representatives from state and county government, as well as practitioners themselves. We're organized as a research translation and implementation support system. And really our goal is to connect research, policy, and practice. So we're always working with these stakeholders in those areas to help them talk to each other, understand one another, and to move these sort of common goals forward. So we're responsible for supporting 3 state-level delinquency prevention initiatives in the state. We provide training and technical assistance for community prevention planning, primarily through the Communities That Care coalition process. We support a menu of evidence-based prevention and intervention programs, and we also provide support for those locally developed juvenile justice programs and we use the STEP for that process, which Deshell talked about to some extent. So across all three of those initiatives, our goals are the same. We want as many communities using these models as possible, using them well, and ensuring that they are actually achieving impact or understanding why they're not, and that those evidence-based models are sustained over time, and that they're as cost-effective as possible. So through all of this work in these different initiatives, we work with about 250 provider organizations across the Commonwealth of Pennsylvania. So here's a matrix that essentially charts all of the models that we support across the Institute of Medicine's continuum of intervention. And I'm really just including this here to give all of you a sense of the diversity of evidence-based models that we support. We support programs that are implemented anywhere from pre-K all the way through high school, and across this continuum, everything from promoting healthy behaviors and attitudes all the way through to sort of maintaining long-term treatment therapies and protocols. These program models include school-based programs, family-based, and community-based, as well as therapeutic treatment settings. One thing that I want to note here is that many of these models, we're lucky enough in Pennsylvania to have a state line item in the governor's budget for delinquency prevention programs, and it's specifically and exclusively focused on providing funding to communities to implement evidence-based programs. And it includes that funding includes some requirements around quality assurance, monitoring from program developers, ongoing fidelity monitoring, as well as data collection, and all of that occurs sort of in partnership with Epicenter. So we provide technical assistance to those models for that state line item, for those programs that are funded by that state line item. So as we begin to start talking about actually implementing what works, I think I absolutely echo Deshell's comments in terms of this is really where the rubber meets the road. This is where we bring science into the real world. And sometimes this can really feel like taking a pretty big risk. Sometimes we don't necessarily know that we're taking a big risk. And I sort of think this picture of this guy holding onto the tires is a good sort of starting analogy. He's not really looking like he's prepared for success, and he may not even have volunteered to be in this role. You can clearly tell he doesn't have many resources to monitor his trajectory and where he's going. And if he needed to change course, it's not clear that he actually could. So while we think of putting the rubber to the road in terms of evidence-based practices, we know this is a great idea. There are certainly a few things we can do to improve the likelihood of success, and that includes having partners, having capacity, and having tools. And with the addition of each one of those, you're in a much better position to perform and to deliver on your mission for improving outcomes. So I'm going to cover each one of these aspects going forward here. So again, I think Deshell did a great job of talking about how important a partnership approach is and how in many ways it can really establish some of that fertile soil for working in the evidence-based space and bringing together people around a common objective. So as you're thinking about evidence-based practices, you know, you can think about this from if you have just a particular model or program that you're trying to run, or if you're thinking about something somewhat larger and more comprehensive around system reform, these questions are all going to be relevant to some extent, because if we spend time thinking about who the key stakeholders are around the programs and strategies that we're implementing, and we think intentionally about who those partners are, you can often wind up with a fairly broad list of people, excuse me, at multiple levels, both within the state, the county, with practitioners, youth and families, and communities. So I think it's incredibly important at the front end to get very clear on what the goals are, what you're trying to accomplish. And that can often take time, and sometimes it takes revisiting. Why are we doing this again? What is this about? What is the core of what we're trying to do here? And so as that becomes clear, then beginning to think about who else can we bring into the fold around this conversation, whether it's around implementing a particular program or going for something broader. Many times you might find that federal, state, or local agencies have some similar goals. Certainly funders, foundations, and philanthropies, other practitioners who are delivering similar services or the same model or program. Local coalitions are another source of partners that should absolutely be considered, as well as universities and think tanks, folks who are interested in understanding what implementation is looking like, or they may be interested in learning more about how to better understand what else is needed. So taking some time to sort of walk through these questions, although each one of them is fairly simple in terms of a question, taking the time to answer them and develop solutions to each one of them is maybe not as simple as it looks on the surface. So once you've got some of those answers, I think the other part here that's really important to take into consideration is that these questions are a mindset. It's not about sitting down, filling out a worksheet, answering this. This is really a mindset and a partnership orientation. So continuing to come back to that is only going to make your work stronger and better, and will certainly be helpful when you're having success and also when you're encountering barriers in terms of implementation. So within the state of Pennsylvania, we have what is known as the Juvenile Justice System Enhancement Strategy. It's our organizing framework for juvenile justice in Pennsylvania, and it institutionalizes the use of evidence-based practices with fidelity and the use of data to continuously improve how the system is performing and the services that it's delivering. The development and adoption of JJSES included lots of collaboration and conversations with a number of state and county stakeholders, including the Juvenile Court Judges Commission, the Pennsylvania Commission on Crime and Delinquency, the Pennsylvania Council of Chief Juvenile Probation Officers, the Council of Children, Youth, and Family Services, which is our JJ Practitioner Network, among many others. And so the development of this statement of purpose was very intentional and was very collaborative in terms of getting many different stakeholders from many different levels to look at it, to contribute to it, to buy into it, and to be champions for it. And we've been very successful in that regard. And in the process, not only relying on partnerships, but it also continues to develop partnerships as we move forward. And JJSES includes a number of things, much like standardized risk assessment and case planning, the use of disposition matrices, as well as the use of the SPEP. So this is sort of a picture of some of our organizing framework in Pennsylvania around the use of evidence-based practices and has deep roots in partnership. So now, having looked at the partner piece, I want to spend some time talking about capacity, because often capacity is where things get fairly difficult. And so what I've tried to do in this slide is to break down capacity into a couple of different dimensions here. So what you have is both general capacity versus a program-specific capacity, as well as organizational capacity versus knowledge and skills. And so my hope here is that as you look at this slide and you think about your own context and the things that you're trying to accomplish, my hope is that you will see some things here that you do already have in place or that is low-hanging fruit in some way. So when we're thinking about quadrant 1 here in terms of general organizational capacity, Deshell touched on this earlier in terms of having talked about one thing working is having passionate leaders with administrative support. And I would say that that would really fall in this general organization capacity piece. This is the foundation upon which your programs and strategies are going to be run. And really are sort of fundamental organizational things that are very helpful to have in place. Obviously, they don't all have to be in place, but to the extent that you have one or more of these things, that's hopefully a place that you can build from. So looking at quadrant 2 then, still thinking within the frame of organizational capacity, thinking now a little bit more specific and looking at program-specific capacity. So this may be, for example, we can use the example of aggression replacement training, ART. You can think about having champions who are within your organization who are champions for ART. You need to have some ability for program-specific data collection and analysis. Again, this would be around ART, so understanding what kind of data needs to be gathered for ART and having the ability to analyze it. Obviously, having folks trained and certified in that program model is going to matter quite a bit in terms of having a high-quality implementation. The one thing I wanted to note here related to agency trainers is that that is a really important sustainability piece. So, Deshell, you talked about how it's important for consistency as well as addressing staff turnover to have manuals and those kinds of things in place. And agency trainers is certainly another capacity that can really help in that way. So looking then at quadrant 3, general capacity in terms of knowledge and skills, so having an understanding of what evidence is, what constitutes evidence, understanding what constitutes the cores of effective and ineffective practices, what does fidelity mean, what does outcomes monitoring mean, why do those things matter, all of those things are important and helpful as well. Quadrant 4 being program-specific knowledge and skills. We go back to our example around ART, understanding the evidence behind that particular program, the theory of change about that particular program, as well as the actual implementation standards around how many weeks and hours it should be delivered, what kind of staff need to be on site for the delivery of that program, and so on. So this is just intended to sort of unpack what we mean by capacity and a few different ways to think about it. You might have strengths in a particular quadrant or two, and I would suggest that as you move forward, try to identify those places where you have strengths, build from there, and look at some places where you have gaps that you can actually address. So thinking a little bit more deeply about, well, what makes up good implementation? I have sort of charted this out in terms of key areas to consider as it relates to implementation. So fidelity is one that obviously gets a lot of attention for a good reason. We want to run the program according to how it was intended and how it was designed and researched, and that's obviously a critical factor. But it's also important to consider the quality aspect of this as well in terms of the type of people who are running the program, the facilities they're being run in, the kinds of training that those program delivery staff are receiving, as well as materials and those kinds of things. So we all know quality when we experience it, and we all know quality when we do not experience it, and this is a really important aspect to attend to. Adaptation, I typically think of adaptation as being the addition of content or materials or sessions. Some folks define adaptation as any sort of change. I really see fidelity and adaptation as being two separate but somewhat related issues. So tracking that and understanding, are things being added or changed, and if so, what are those changes and why are they being made? So looking now at reach, we of course want to be able to deliver the program to enough people, and I would say really the appropriate number of people. Some models are not meant for large groups, and some are made for larger groups. So we want to make sure that when we're implementing, that we're implementing to enough of the right people, not too many, not too little. So reach is somewhat distinct from completion. So you may have, you know, in a 15-session program, a youth who has participated in 3 sessions, and that's obviously not the same as that youth getting enough duration and dosage of that program for that program to actually make a meaningful change in that young person's life. So that's an important metric as well. And then, of course, cost. We want to be able to say something about what is the cost per participant based on how we've funded this, based on, you know, whether we've been able to negotiate discounts around training and those types of things. And so attending to all of these pieces then can give you a very good picture around how implementation is going and how likely is it that we are achieving the outcomes we're pursuing by running this program or strategy. So in sort of tandem to each of these components, you know, it's important to consider the data collection aspect of each of these. So, you know, it may, again, sort of thinking about what's the low-hanging fruit for you and what are you likely to be able to accomplish. I would suggest that, you know, based on our own experience, having access to somebody who is good at Excel or at Access or some other type of relational database is probably enough to at least get started. Across each of these, you want to be thinking about sort of standard formulas for gathering this data. So for fidelity, across all of the programs that we support, we established sort of a 75% level of fidelity as the sort of minimum acceptable standard. That, of course, math is going to look a little bit different in terms of number of sessions and that kind of a thing, but being able to sort of have some consistency in looking at, for example, for comparing two implementations of the same program, you want to be able to say something meaningful about that comparison and use sort of apples-to-apples formulas. So this is, of course, one place that we struggle. Deshell, you talked about that. We see this here as well in terms of the data collection piece. And I would just suggest that, you know, start with the low-hanging fruit, start with the strengths that you have. And if you were going to sort of prioritize a place to do your data collection, I would suggest starting from the top and going down, if you will, because that fidelity piece is going to be really one of the most important pieces if you want to have any confidence in your likelihood of achieving outcomes. So just a few wrap-up thoughts in terms of starter strategies. You know, I think there's similarity in what Deshell has talked about and how we see this here. We really want to focus on continuous quality improvement as opposed to an emphasis on compliance. So the culture around how you're using that evidence-based program really matters tremendously because you have the opportunity to either engage your providers and your stakeholders or to disenfranchise them. So sometimes I think there can be a tendency to be overly rigid when we're talking about evidence-based programs. And we've seen some, you know, pendulum swing here in Pennsylvania even in terms of, you know, a period of time where EBP was the be-all, end-all. And, you know, I think we also recognize, well, there is not an evidence-based program for everything. What do we do when we get to that cliff? And so we want to make sure that we are bringing everybody who's invested in the well-being of kids forward with us and not disenfranchising those folks who may not be running EBPs or may not really understand implementation. We don't want to be punitive. We really want to raise the C-level together. So ways to do that could include cultivating communities of practice, so getting you know, folks who run the same type of program model together and having them learn from one another is a very effective strategy for building networking and sharing of skills and successes and challenges. As well, it may be that it makes sense to develop some type of subcommittee or work group that is specifically focused on implementation. And it might be that group that spends some time identifying what kind of capacity they want to build. And it might be that they really focus on general capacity with the knowledge and skills to understand evidence and what fidelity means and those kinds of things. And my last recommendation here is really focused around incorporating those implementation quality expectations into fundings, into contracts, into solicitations, but that as part of that, that there is some type of support that's also provided to help those folks meet those expectations. So it's not just sort of this mandate that, that doesn't really provide or help those practitioners gain the capacities they need to meet that bar. So these are some of the things that we have been using in Pennsylvania and have had some success with. And with that, that's all I've got.
Great. Thank you, Dr. Bradley, and thank you, Ms. Parker. We're really excited to have such a distinguished panel of experts today. And we have about 20 minutes to speak with our presenters, ask some questions, and we'll try to get through as many questions as we can. And I encourage participants in the time remaining to continue to type their questions in the chat box. And the first question that we want to tackle is for Ms. Parker. How did you modify contract language to include quality assurance language?
Okay, thank you. Essentially, our existing contracts had basic language that said compliance with quality assurance efforts. It was general to that. However, quality improvement was the element that was added. So in those same areas where there was language around quality assurance and the expectation to comply with auditing measures, there was just some additional language added to say, in addition to the corresponding improvement projects around that. So it was just really some small modifications to be specific about the fact that quality improvement was also a component of quality and it's not limited to auditing. I think that perspective shift around when we say quality assurance, the fact that your mind automatically goes to a red ink pen, that's the paradigm that we're trying to shift, and that is not always about the red ink pen. It's also about carving out that time to look at how do we get better and continuously get better.
Great, thank you. And for both of our presenters, do you know of any evidence-based mentoring curricula to high-risk youth?
I would say go ahead, Deshell.
I don't have any specific references around that. I do know that that's one of the, when it comes to looking at the SPEP tool, mentoring is one of the higher scoring areas or component services that you can offer youth that has a great impact on recidivism when done correctly. And so there are quality measures that are components of the SPEP tool, as well as dosage minimum targets around how much you should be giving the mentoring service. So that is some of the evidence that we use to inform our mentoring programs. And then we've also looked at implementing things like the trauma-informed knowledge, the evidence-based, not evidence-based, but goal setting, and having an actual case plan for our mentors, definitely taking it beyond just the basics of kind of taking youth to a basketball game, but even reimbursing them for documentation and transportation, which is definitely beyond what we have traditionally done with mentoring. And through some of that focus and energy around applying some of the SPEP components and trying to make mentoring more attractive and more of a quality service, we've had some service providers who have approached us and have actually started to develop curriculum around the mentoring service and wanting to do something more specialized with that. So it's been an organic process that has evolved, but I don't have anything specific that is out there around evidence-based mentoring beyond what the SPEP provides.
And I would just add to that, I think probably the best thing to do would be to go to the OJJDP Model Programs Guide and take a look. I did do a little bit of a search there around that just to see what came up, and I see Big Brothers Big Sisters still as having the most evidence, but there are a couple others there that may be of interest to you, so we definitely recommend checking that out as a resource. The one thing I would say to piggyback on Deshell's comment around sort of looking at it from the SPEP perspective, which draws in that meta-analytic perspective, looking across a variety of model types, you know, if there's an interest or movement toward developing something locally sort of based on the meta-analysis and other programs that are out there, I would just be conscientious around ensuring that those mentors have a really good understanding of what does not work in the space of prevention. So, you know, getting beyond sort of just education, but also understanding that skill sets need to be developed, which I think is what part of what we're talking about here, and that you know, they're able to sort of help scaffold that youth in a positive direction without you know, the preponderance of the time being around lecturing or that kind of a thing.
Great, thank you both. The next question is, are you aware of any evidence-based programming for youth with substance use needs?
Is this around more, this is less around prevention, but more around treatment? Is that sort of the question?
I think so. I think it's more focused on youth who are already in the system.
Mm-hmm. Mm-hmm. Yeah, I think, of course, multi-systemic therapy and functional family therapy would be the first two models that I would point to. They obviously have sort of a clinical therapeutic intervention approach, but both of those models have a really high level of infrastructure for supporting therapists who are certified clinicians in those models. So I think that's a real strength of those. Certainly you could connect with the developers to find out if there are those kinds of resources available to locally in your area. And then I would also, again, sort of defer back to the model programs guide. I personally can't say enough about that resource. I think it's really one of the best resources out there for understanding what programs do exist to address, you know, all different types of problem behaviors and needs, and does a very nice job of summarizing the evidence and the extent of evidence and the weaknesses of the evidence as well.
I would definitely echo that, and we have a clinical services coordinator here, so that would definitely be more of their wheelhouse. This is not my area of expertise. However, with that being said, I would echo what Stephanie said around the FFT and the MST, but then I would think, in addition to that, kind of what we've learned, even with the application of the SPEP tool as an evidence-based model, we've been able to weed out a lot of our AOTA providers who, while may have had great relationships with the community and the youth and families that we're serving, were not actually delivering the model to fidelity. And so that is a huge thing. Sometimes it's not about finding some other magic bullet, but it's about looking at what you're already doing and figuring out why that's not working.
Mm-hmm.
Thank you. Our next participant asks, outside the scope of administrative organizational impact on implementing evidence-based programs for youth, how can we as employees be impactful? So I think this question is about how staff can really play a role in this implementation process to help support the implementation of these programs.
Well, from my perspective, I think it's two things. I think the buy-in. So as staff, you have to be a champion of it. It's not something you should just take or leave. It's not something you should not be willing to take seriously, but actually be a champion of it, and then educate yourself on it. Take advantage of the opportunities that the place of employment may be offering regarding training and developing your knowledge and understanding of whatever practices, tools, programs it is that are being implemented. But I think in addition to that, championing the message to the youth, the families, everybody involved, other coworkers, other colleagues, supporting management and implementation of it. I think there's definitely a key role for staff to play, and buying into it, believing in it, and championing it, I think, are key things that are essential to any kind of evidence-based program being successful in the system.
Yeah, I would agree. I feel like sometimes, you know, we can, in our organizations and in our roles, get a little too narrow sometimes in our thinking. around what our role is with our particular program or practice. But I think to the extent that this type of approach resonates with you, sort of follow that. And really, I would say the same things in terms of education and championship. You know, to the extent that you feel like you can speak competently and confidently to the issues of implementation or the need for use of evidence-based programs and strategies, that's going to help the bigger mission overall, because that really, what that does is that says you are a partner in this process too. And it may not be that you have a quote unquote formal role with it, or you know, you have this administrative organizational role, but there's always a need for more partners. There's always a need for, there's always more work to be done. And I would encourage you in that regard to sort of go think, ask this question back internally in your organization. How can I be impactful? What is an additional role for me to play? I certainly think participating in webinars like this helps you do both of those things in terms of gaining education and becoming a stronger champion. And there may be other things out there too where you might be able to find additional resources, whether it's data collection tools or fidelity checklists or those kinds of things where you might be able to, you know, if you have 20 minutes, you might find something that is of great use to your organization.
Thank you. Our next question is, you discussed setting target outcomes and performance standards. Are there key performance or outcome measures that you would recommend that programs collect to ensure programs and services are producing positive outcomes? And do you have any examples that you can discuss of strong data collection policies or procedures you've seen?
Okay, so this is Deshell. When it comes to, I think there was two parts in there, the program outcomes and then the data collection. I think when it comes to the program outcomes, I think it's important to analyze the specific program or service it is that you're speaking of, and then develop program measures or outcomes that are specific to that program's goals. What is the intent of this program? What is it that we're looking to do? And then be able to measure whether or not that's actually happening. For example, if you have a program that is based on job training, mentoring, education, and then job placement, then set your goals around that. How many youth are actually successfully completing the vocational training? How many youth are actually placed on jobs? And then look at time frames beyond the placement. How many youth are keeping those jobs at 3-month intervals, 6-month intervals, so on and so forth, beyond the basic recidivism that we always all track because we're in the youth justice system, but being able to look at that specific to programs as well. How many youth recidivate while they're in this program? How many youth recidivate after this program at the 3-month mark, the 6-month mark, so on and so forth. So I think those are definitely good program measures to have that are specific to whatever it is that's being delivered. But then I think in addition to that, having the success stories, who actually completes, who is graduating, developing measures to see if the skills that you're teaching have actually been learned and have been implemented in real-world ways. I think for me, the biggest thing is not having arbitrary outcome measures that just measure things that people don't really pay attention to or doesn't resonate with people, but measure things that people are going to understand. And implementation of skills learned is a big deal because as a youth justice system, that's what we're supposed to be doing, teaching youth skills so that they don't repeat the same behaviors, and measures to actually show that is definitely a huge piece of it.
Yeah, and I would add, I don't think I did a good job of describing this before in one of my last slides, but I think building on what you said, Deshell, is the idea of providing a clear definition or a guidance around defining how to measure certain things. So if we're looking at recidivism rates, what does that mean? How are you defining recidivism? How do you want folks to measure that and examine it? So that it's not up to every single individual or interpretation or their interpretation around, you know, recidivated.
Thank you. Do you see legislation as necessary to ensure long-lasting systemic changes?
I definitely think that it is. This is Deshell again in Milwaukee. I definitely think that it is, but it's not kind of the first key. That is a very broad level piece, and I think it's necessary to be able to support it from the long-term perspective and having consistency in the quality and the way you ensure quality across various programs and systems. But I think the on-the-ground work is definitely a huge piece of that, and probably even more meaningful than the broader legislation when it comes to defining your own measures and specific success and how you define recidivism and the parameters you put around that, and being able to measure risk score changes in youth and those kinds of pieces. I think that needs to happen first to inform the way legislation needs to change, because a lot of times the legislators are the folks who really are not on the ground. So I'd rather us, the ones who are on the ground doing the work, be more clear about how we're defining what success is and what is happening with the youth, and then that inform legislation versus the other way around.
Yeah, I think my answer is somewhat similar. I had sort of a yes and no response to that, in that I think on the yes side, legislation is important for establishing the tone and the expectations around how taxpayer dollars are going to be used. I think that's important, and it's important that we progress down that path of using evidence that has largely been generated from taxpayer dollars so that it feeds back into communities. So I think from that side, yes, it's important, and for the long-term sort of sustainment, establishing sort of a culture and a norm around these pieces is important. But I also sort of echo the sentiment that, you know, just because there's legislation doesn't mean that it rolls out well or that expectations are clear or founded in a real understanding. And so I think from that perspective, having this local, you know, an implementation culture around continuous improvement as opposed to compliance is a really important part of it. It's hard to legislate quality, and so there's a bit of a disconnect there in that piece. But I certainly think there is a place for legislation to play a part.
Thank you. So I think we have time for one more question. And one of the questions folks are interested in is learning more about how to sort of identify the right services for a specific region. So jurisdictions obviously have limited resources to implement these types of evidence-based programs and services, right? So how can they best use those resources to identify the right services for their jurisdiction and their population, and meet the needs of the youth in their neighborhoods?
Well, I definitely think there has to be some grassroots efforts there. I think being a member of the community and not just an employee in this field, sometimes, oftentimes, many times, things are done to you. There are people in rooms with the doors closed making decisions about what they think is best for you and your family and your community, but they've never been to your community. And so I think you have to peel some of those layers back and be willing to go in the community, hold some focus groups, hold some community meetings, and actually ask people what it is that they think they need, have some type of client satisfaction process in place, and ask youth what it is that they think they need, and then be able to develop programming and services around that. We definitely have evidence out here and knowledge around what works, and that's part of what I do enjoy about the SPEP tool. It provides guidance around that. But separate from that, again, being a member of the community, come ask me. And that's a good place to start.
Oops, sorry, taking myself off of mute there. Yeah, I think sometimes this comes back to capacity and to funding, right? And that we may not have the personnel resources, we may not have the dollars, we may not have just the sort of ability to navigate program registries and those kinds of things. One of the most important things that I think can be incredibly and powerfully protective in a community is just that sense of and that reality of community members coming together around a common issue and around a common goal to say we want to figure out a way to address this, even if it doesn't wind up in developing a program. Simply having you know, a collaborative group coming together around the table to say, hey, we want to do something about what's going on in our community is incredibly powerful. And I would say to that end, the use of the communities that care process is particularly powerful in that regard. And there's research that has demonstrated just going through the process of implementing CTC is a protective factor for use in the community.
Great, thank you so much. And thank you again to both of our presenters today. We really appreciated your taking the time to share your wisdom and experience with us. And thank you to our participants for all the great questions that we received on today's webinar. And thank you for attending today's webinar. Have a great afternoon. Thank you.
Thanks for having us.
Thank you.